come back to Dr. Carson. He has a few people who are going to be with him in the testimony. So we're waiting for an interpreter and also some of the people who are going to join. We have next person on our list is Fredrick Dombrowski. Welcome, Mr. Dombrowski. Thank you for being here.
Thank you so much for the opportunity to be here, specifically to talk about a potential amendment to SB 1228, an act concerning state healthcare workforce. We're asking that you would include legislation specifically regarding the counseling compact. To Senator Anwar and Representative McCarthy-Vahey and the members of the committee, we thank you so much for all the wonderful work that you do, especially eating during your lunch. Thank you so much for the time that you're giving us today. We greatly appreciate it. So my name is Dr. Fredrick Dombrowski. I am a proud Connecticut resident. I am a department chair and professor with the Clinical Mental Health Counseling Program with the University of Bridgeport. I am a proud member of the Connecticut Counseling Association, and I am the president of the American Mental Health Counselors Association. And specifically, we're here today to talk about the benefits of adding language regarding the counseling compact to Senate Bill 1228. Specifically, the Counseling Compact is an interstate compact or a contract among member states allowing professional counselors licensed and residing in a compact member state to practice in other compact member states without the need for multiple licenses. Speaking on behalf of the American Mental Health Counseling Association, the board of directors of the American Mental Health Counselors Association fully endorses passage of the Counseling Compact by state legislators. AMHCA advocates for over 130,000 licensed clinical mental health counselors, also known as licensed professional counselors here in Connecticut, in the United States who are licensed to assess, diagnose, and treat mental health disorders. The members of our board emphatically endorse the Counseling Compact because it provides for greater individual and family access to mental health services offered by licensed counselors, consistently high standards of public health safety in participating states, continuity of care for patients who need continuing mental health counseling when patients or counselors relocate or travel to other states. Also, military personnel and spouses to maintain their licenses to practice when relocating so that their services are readily available to the public. Also, increased mobility for fully licensed clinical mental health counselors, and state licensure that is preserved and strengthened in the respective participating states. The Counseling Compact is supported by our members of the American Mental Health Counselors Association. Currently, there are 19 states which have signed on to it and 19 states which are seeking pending legislation. So our professional organizations, not only the American Mental Health Counseling Association, but also the American Counseling Association and the National Board for Certified Counselors. Also, my students who are going to be working in Connecticut and also the surrounding states to help improve the mental health care which is being provided. And ultimately for the Department of Defense and military families who are asked to move relatively quickly to be able to meet the needs of people across state lines. There's a ton I could talk about, but I would like to turn it over to you if you have any questions.
Thank you so much for your testimony, and thank you for being within the timeline as 3 minutes.